Hello, AAS Endocrine Surgery Fellows. This is Dave Hughes on behalf of the AAS Fellowship Committee. I wanted to make this video to help explain the upcoming endocrine surgery and trustable professional activities and go over the logistics on how you can start requesting these of faculty that you work with at your fellowship. So a lot of people know in trustable professional activities. I've been around for a while in general surgery. They may have been involved in your general surgery training. Many fellowships and other surgical programs are adopting these this year. These include things like vascular surgery, surgical oncology fellowships, and our endocrine surgery fellowships. So the purpose of EPAs are to provide you as a fellow frequent formative feedback about your performance of evaluation and management of patients with common endocrine surgery disorders. The idea is that if you get very frequent micro assessments throughout the week, you'll be able to see things that you're doing well, things you can do to improve. The purpose of this is to kind of improve overall feedback for you as the fellow. The core endocrine surgery EPAs are listed here. Similar to the general surgery EPAs, we have different phases of care. So the phases of care can include preoperative, intraoperative, or postoperative care of a patient. So preoperative would be seeing a patient in clinic for workup of a thyroid nodule. Intraoperative would be doing a thyroid lobectomy on a patient with a thyroid nodule. And then postoperatively would be either taking care of the patient in the hospital or when they come back to clinic for their postoperative visit. You can take care of a patient through all three of those phases of care. So when you ask a faculty for an EPA, if you've seen a patient from start to finish, you could ask them to select every operative phase of care for that particular patient. The core endocrine surgery EPAs are common endocrine surgery disorders, things like taking care of a patient with a thyroid nodule or differentiated thyroid cancer, taking care of patients with benign thyroid disease. These could be things like Graves' disease, a thyroid nodule, perhaps. Taking care of patients with persistent or recurrent differentiated thyroid cancer, where they've had initial surgery and then have a recurrence. Initial presentation of hyperparathyroidism, which includes primary, secondary, or tertiary hyperparathyroidism. Patient with persistent or recurrent hyperparathyroidism, where they've had prior parathyroid surgery. Taking care of a patient with an incident or a functional adrenal mass. There are some core endocrine surgery EPAs with a single phase of care. This is taking care of a patient with an inherited endocrinopathy, performing ultrasound on a patient for assessment, most likely of a thyroid or parathyroid disorder, performing care of a endocrine surgery patient in a multidisciplinary fashion. This could be a multidisciplinary clinic or participation in endocrine surgery tumor board, and participating in a scholarly effort, which could be presenting an abstract, publishing a paper, doing a book chapter, things like that. There's some elective endocrine surgery EPAs. These are less common things like advanced thyroid malignancy, patient with adrenal malignancy or metastasis to the adrenal gland, patients with neuroendocrine tumors. These could be things like a pancreatic neuroendocrine tumor or a gastric or enteric neuroendocrine tumor, and then a pediatric patient with some type of endocrine surgical diseases. These are not required like the common disorders, but you can request EPAs from faculty for elective things like that. So Firefly is the software that the AAS contracted with to collect these EPA assessments. And there's a couple different options to access the software. One is a web-based or desktop application, or you can download the application onto your phone, or you can do both. The functionality of both is very, very similar. So in order to select an EPA, you would open the application either on your phone or on your desktop. To create an EPA, just click Create EPA. This looks a little bit different for me because I'm on the faculty side of things, but on the fellow side of things, your name will be here. The faculty will be a drop down here. You can select the faculty you work with on that particular day, select the activity date. You can put in a description. The patient interaction. So for this one, it might be a benign thyroid nodule workup in clinic. You can select the EPA type that you would like for that particular encounter. That's all you have to do on the fellow side of things. You'll hit submit. The faculty will receive an email to say that you've requested an EPA from them. It'll also pop up in their application that they have a pending evaluation. So I would open up the EPA, I would see this, and I would select as the faculty the case difficulty. And then since this is a preoperative workup, I would select a level of entrustment. The different levels of entrustment are included in a drop-down menu here for faculty. It goes everywhere, everything from limited participation, direct supervision, indirect supervision, practice ready, and then can teach others. And there's these anchors and descriptions in here that help the faculty select which entrustment level you performed on that particular patient. Once this is completed, the faculty can provide feedback to you. These might be more specific things, and we're really encouraging the faculty to include formative feedback for you, because that's really the nuts and bolts of how you perform that particular interaction. The faculty hit submit, and then you'll get an email or in your Firefly app a notification that an EPA has been completed for you. On your dashboard in your Firefly application, you'll also be able to see all your prior assessments. So there'll be a menu of all the different completed EPAs or pending EPAs that you've sent to faculty they haven't yet completed it. So that's the Firefly application. It's pretty straightforward. Our expectation for this year is really just progressive engagement of you as a fellow with the EPAs. So we're going to ask you to try to do about 3 to 5 EPAs per week when you're doing clinical work, and try to send them to a variety of faculty that you work with so you get kind of a 360 view of your overall performance. Next week, AAS will send out login information to you as the fellow and some additional instructions on how you can download the Firefly software onto your phone or onto an application on your desktop. You can also obviously just go to the website and access it there. So we're excited about starting the EPAs for nipple surgery. I think it's a great opportunity for you as a fellow to get more performance feedback and help you get better and better throughout the year. So if you have any questions, please reach out to me with any questions. I also created a video for program directors and faculty at your institutions, so they'll be able to help complete the EPAs for you. Thank you guys so much. Have a great year.